Okay, Lachlan, so today what we're going to be doing with this exercise is I'm going to be training your rapidly alternating movements in the forearm muscles and also the smoothness of your movement, because I am noticing you have decreased coordination when you do move those forearm muscles, and you also have very jerky movements when you're moving your arm away from your body. So to do this, I'm going to get you to pick up the ruler, and I want you to place your hand in between these two first bottles, and I want you to go back and forth with the ruler touching each bottle. Okay, you can stop. Now I want you to go to the second set of bottles with your hands in the middle, and I want you to do the same thing. Okay, so I'm just going to move these back a little bit closer to you because I notice they are a little bit far. Okay, so now I want you to go a little bit faster, and I want you to go to the first set of bottles, the second set of bottles, the first set again, and then you can stop. And I want you to hit it 5 times. Okay, on the count of 3, or you can go whenever you're ready. Okay, that's great. So now to progress this, I want you to lift your forearm off the table, and I want you to go as fast as you can and try and make hitting the bottles even. Okay, go. Good job, Lachlan.
The aim of this exercise is to improve the coordination of rapid alternating movements, as well as increase the coordination of onset and offset of antagonist and agonist muscles. This exercise targets dysdiadochokinesia, which is defined as the decreased coordination of rapid alternating movements. This impairment is addressed through the exercise with the patient asked to make rapidly alternating movements of quickly pronating and supinating their forearm and hitting bottles on either side. During the exercise training, the patient is able to practice focusing on the coordination and timing of those movements. This exercise is set up in such a way that the patient can hear and see if they're achieving the desired rhythm, which ideally would be fast-paced and regular beat. The patient can also observe if their alternating movements are isolated to the only wrist joint and if they are smooth in nature. The patient would also progress the exercise and lift their forearm off the table to increase the degrees of freedom to be controlled.
This exercise also addresses dyssynergia as the patient practices reaching and manipulating their hand whilst holding a ruler between the 70% and 100% arm's length distance targets. By practicing this reaching aspect, the patient aims to tap the ruler between the bottles positioned on the table. The patient is also cued by the therapist to perform alternating supination and pronation of the forearm at the different distances at a fast pace, which will encourage the patient to practice the correct timing and activation of the agonist and antagonist muscles. This will increase the overall smoothness of the movements at the shoulder, elbow, and wrist joints. Overall, cerebellar ataxia has been shown to be caused by multiple diseases such as stroke, traumatic brain injuries, degenerative diseases, and alcohol abuse, leading to abnormal coordination affecting the amplitude, accuracy, timing, and force of movements. Our exercise specifically targets the ataxic impairments of dyssynergia and dysdiadochokinesia in order to increase the coordination of the agonist and antagonist muscles of the upper limb during reaching and rapidly alternating movement tasks.